I get this question a lot, and I do have patients that are concerned when they first start seeing me about their HRV number being too low. Now, HRV is a very individualized biometric, right? We do have some population norms, and those are there for good reason. Being it a very individualized biometric, you don't want to get too caught up in the absolute value. It's really about stability of HRV over time. As I'm measuring it, what's my highest baseline high and my lowest baseline low? That's usually going to be about 20 millisecond difference right there. We want to stay in this range of stability. That's really the most important thing that these wearables like Aura and Whoop and BioStrap, Fitbit, Garmin, that's what they're measuring, this nighttime resting HRV during the night. And they average all of that data, including deep sleep and REM sleep, where heart rate's going to be a little bit more erratic. They average all that data and then give you the average HRV. Now, that metric is measuring a biometric called RMSSD. RMSSD is a very short-term metric. We can look at it from hours all the way up to 15 minutes. Now, the cardiovascular research, what that's based off of is a metric called SDNN. And SDNN, a different metric that's more long-term. So the shortest amount of time that we look at SDNN is 24 to 72 hours. I usually do a 72-hour measurement with patients. Because it's a more long-term measurement, it's a better assessment of cardiovascular risk factor. We don't want to extrapolate data from wearable devices because it's not measuring the same thing as far as cardiovascular risk factors. That SDNN metric, which is a longer term metric that's measured with a Holter monitor, ECG or EKG, where there's several leads placed on the chest wall with a wrist strap or a ring. So focus on individual stability with those wearable devices. And if you're working with a doctor that knows what they're doing with that SDNN measurement that's 24 hours or longer, then you can assess cardiovascular risk factors.